Hello, everyone. Good evening. My name is Koustav Chatterjee. Welcome to the Thought Leadership session powered by Voice of Healthcare. I'm a principal working at Frost & Sullivan, and I have the unique privilege today to host Mr. Pankaj Sahni. He's someone who needs no introduction in the healthcare industry in India. He's basically the CEO of Medanta Hospital, one of the biggest private hospitals in India, with 1,600 plus beds, managing 22 different healthcare specialties under one roof. And I have the tremendous privilege and honor to host him today to basically get his feedback and perspective around managing large healthcare businesses during and post COVID-19, and also the national digital health policy that Government of India Ministry of Health launched this year, which aims to fundamentally transform the way healthcare delivery is conceptualized and offered to patient population in India and abroad through an integrated IT infrastructure. So, what's his point of view in reference to national digital health policy? How feasible it is for hospitals to completely invest in that mission and offer capabilities that seamlessly align with the government of India's vision of offering integrated, personalized, and individualized healthcare to patients in India and abroad. So, with that being said, I would like to formally welcome Mr. Pankaj Sahni, CEO of Medanta.
Thank you, Costa, and thank you for that very warm welcome. And thank you to all our listeners.
It's my pleasure, sir. As we initially discussed, let's start with the National Digital Health Mission. It's one of the most transformational and foundational policy in reference to healthcare information technology and healthcare overall in India. I remember back in 2017, I was part of a discussion where we deliberated the need to have such a policy. And since then, as a company, Frost & Sullivan, along with government stakeholders and thought leaders from the private side like yourself, we collaborated in multiple scenarios to basically visualize what should be the future of healthcare in India, supported by a seamless integrated information technology infrastructure. Now that we have the policy in place, some of the stakeholders are doubting and kind of concerned about the timing of the launch because COVID-19 is basically overwhelming every health entity today. And at a corporate level, some of the smaller hospitals are basically too much into offering care to the COVID-19 patient population. They are also struggling with their margins because elective procedures were not done. Patients couldn't travel to India due to travel restrictions due to COVID-19. I think some of that impact can be translated into Medanta and some of the other institutes like Medanta, which cater to a large segment of all international patients that come to India for affordable and quality healthcare. So, with that being said, I just quickly wanted to get your feedback on the overall policy and how feasible for a large healthcare institute like yourself to commit 100% to that policy. And if that's not the right time today, when would that possible? When would that be possible?
Thank you, Costa. So I think, first of all, the National Digital Health Mission is a absolutely needed, absolutely warranted policy and approach for Indian healthcare. And if you ask me, has it come at the right timing? I would say, absolutely, it has come at the right timing. In fact, no timing is too soon for us to actually think about using digital to help with healthcare delivery for a country like India, and indeed using India as a launching platform for almost 2 billion people who are in a similar situation as India, whether it is Africa, Southeast Asia, South Asia, etc. So I don't necessarily think that that there is a timing issue, and we'll touch a little bit on COVID. I think, frankly speaking, the time for digital involvement, technology involvement in healthcare delivery has been there for some time. And in fact, if you look at the demands of our patients, probably they have been ready for this even before maybe some of the healthcare institutions and those who work in the healthcare field have been ready for it. So I think that this is not at all too soon. I think it's absolutely warranted. And for a country like India, which has huge challenges with respect to healthcare delivery, whether it is because of the population size we have to cover, whether it is because of distribution, whether it is because of the income constraints and the high cost of delivery, I think the only real way for us to think at getting anywhere close to something like universal healthcare, which has been a stated mission, not only for India, but for many countries, that digital is going to be an absolutely key part. Now, I want to caution on one point, which is that, it is not like digital and mobile is this magic wand that we will just wave and suddenly magically everybody will get healthcare. I think that it is very, very important for us to understand, and all the stakeholders that are involved, whether in NDHM or otherwise, that fundamentally healthcare typically involves a patient and a caregiver, which in most cases is a doctor. And that trust bond, that relationship is the most important and most sacrosanct thing in healthcare. What we need to do is figure out a mechanism where we use healthcare delivery using digital and mobile and other technologies to elevate and enhance that. And therefore, the online offline integration, in my opinion, is what's going to be key. And if anything, COVID has shown us that digital is actually more critical in delivery of healthcare, because COVID showed us people couldn't leave their houses. I mean, we at Medanta, we saw our teleconsultations grow up almost 10 to 20 times because people were afraid to leave their houses, or they were in lockdown scenarios, but they still needed to access healthcare. So, I think COVID actually is a great stimulus for us to get more active in digital, more active using technology for delivery of healthcare.
Thank you for that insight. So speaking about telehealth, we all acknowledge that that's one industry within the broader healthcare IT spectrum that has grown faster than any other segment. And that's not only the case in India, but across the world. Some of the smaller telehealth companies have merged in North America and went for large multi-billion-dollar valuation IPOs. And that actually proves that the future basically is something that belongs to telehealth and telemedicine, which basically is a broader concept. Telehealth is again teleconsultation, where a patient and a provider connects on a personalized basis through a video call, but telemedicine encompasses digital therapeutics as well. So the combination of telehealth along with other online enablers that allow a patient populations to stay healthy, stay in course of their care plan, which will ultimately result in improved outcomes, is something that the future really demands, and that it has been consistent across the world. So thank you for validating that insight. I also have a personal history with Medanta's telehealth capability, not as a patient provider relationship, but when I remember in 2018, I was coming back from New York, and I had a layover in Delhi airport. And at the airport, I saw the telehealth kiosk of Medanta, and it really opened my eyes. But I never realized that we could see such commercialized application of telehealth in an airport or in any other areas, which is probably used very commonly, not only by patients, but overall the consumers. So the consumerism of healthcare, I can proudly say, has been pioneered by Medanta before COVID-19. So you had a unique advantage of scaling up very quickly when the demand really surged for telehealth. Now, moving on to the next area of discussion, which is basically a more serious aspect of managing 1,600 plus bed hospitals during COVID-19. We all acknowledge that large hospitals suffered tremendously because elective surgeries were not performed at a scale which was previously done. Patients couldn't travel to India from many countries due to restrictions of COVID-19. And just trying to get your feedback on, as you move forward after the vaccines are available, how do you think that Medanta will be back in full capacity, if it is already not, and can create sustainable value for all stakeholders involved?
Right. So, first of all, Koustav, we at Medanta have always tried to look at it as patients rather than consumers, or as rather than customers. And it's very important that we kind of maintain that grounding as we think about healthcare delivery, is always put the patients at the center, or put the patients first, is often what you hear people say. Now, we at Medanta have actually always tried to think of this not in terms of the so-called corporate or so-called consumerism. Yes, we are a professional institution, and we like to use, the word professional hospital rather than corporate hospital, because our ethos has always been around ensuring that it is the patient's needs that are getting attended to first. And the philosophy that good business may not be good medicine, but good medicine can be great business, is kind of how we have tried to run our organizations, whether it is our hospital here in Gurgaon, or our new ventures in Lucknow and Patna and other
Yep.
places, or indeed our
Yep.
clinics at the airport in Delhi. So we've
Yep.
actually always looked at this from the point of view of saying, what's the right thing to do for the patient? And that
Yep.
has actually led us to things like digital, telemedicine, availability, access to patient care at home. So this concept of taking the care to the patient rather than the patient to the care is something that we have actually been trying to do. And we have done that even during the COVID pandemic, where we've actually started home monitoring for COVID, post-operative care at home, post-COVID rehabilitation monitoring, chronic care monitoring using digital technologies, etc. Now, there have no doubt been some challenges with the pandemic in terms of the lockdown, in terms of access for patients to care. We have been very fortunate with our entire team of doctors, nurses. We were one of the first private institutions in India to actually look after COVID patients. So we actually got ready a little bit early, and
Yep.
based on our philosophy, the way the organization was designed in terms of managing isolation wards for COVID patients, etc. We had actually foreseen a lot of these things, and infection control and management of these things has been inbuilt into our culture and our building designs as well. So we were able to actually ride out a lot of these challenges fairly successfully. Now, no doubt there were some pressures with respect to access for patients to care, but I think one was definitely the burden on the finances of an institution, where we did have to take certain kinds of austerity measures, tighten
Yep.
our belt, so to speak.
Yep.
But more than that, we were very concerned about the fact that patients who do have needs for accessing urgent care were unable to access care because of things like lockdown and travel restrictions. And we tried to
Yep.
overcome that using various means and methods that we could. Now, we have seen as the lockdown has eased, those numbers kind of come back. Obviously, we treat a lot of patients from around the world with flights,
Yep.
and especially international flights being restricted.
Yep.
That has
Yep.
slowed down to some extent, but we see some of that now starting to trickle back. We also see that patients who are not able to get care during the months of maybe April, May, June, they have started to come back to hospitals. And being a kind of very tertiary care destination
Yep.
institution deals with very complicated cases, unfortunately,
Right.
patients many times can't actually delay their care. So many patients did actually come. We were able to isolate COVID care in one area and make the rest of the hospital completely safe for managing tertiary care, even while COVID patients were being attended to. And that's in fact what we're still doing. So I don't think the pandemic is over. I think we still need to be watchful about that stuff. But we have been able, through our doctors, our nurses, and the phenomenal teams that we have across our institutions, actually maintain a fairly good access to care for the public for even non-COVID treatments. But no doubt it
Sure.
has been challenging. We have kept a close eye on our expenses and our cash flows, etc. But we've been lucky and fortunate to actually being able to ride this through for the most part, at least until now.
Glad to know that. Um, Next, what I'm trying to do is to connect the dots between National Digital Health Mission and our vision to offer personalized care to global patient population. And one key area that we also need to focus on is the data retention and archiving policy. Last week, Government of India approved the data retention policy that is part of the National Digital Health Mission. So just trying to understand, because you cater to a large patient population coming from different countries all over the world, how are you planning to protect patients' interest by retaining their data within India, or offering the necessary access they need from their countries to stay in touch with their providers? Because when I interacted with some of the other hospitals based in South India, catering to a large patient population coming from outside, they raised this concern that we are pretty basically not very sure about the data policies of those countries. We are pretty sure about the data policies we have in India, but then there are confusions around if a patient is coming from a GCC market, let's say Dubai, for example. How should we, protect that patient's interest by complying with the regulation we have domestically, and also the regulation that applies to him in his country in Dubai? So, with that perspective, just trying to understand what are the different measures you've taken or initiatives you're supervising to ensure that this particular concern is addressed effectively?
Right. So, Kaustav, we at Medanta have actually invested in digital and technology, electronic medical records amongst them, right from the time we started the hospital way back in 2009, 2010. So, we've been focused on this from day one. We have very advanced electronic medical record systems which capture patient information, allow doctors to access that information and history of the patient. And a lot of these softwares, which we have been able to get from various international companies, they all tend to be compliant with the US HIPAA compliance laws, etc. So we've been very conscious about data privacy, data protection, etc. from day one. And we've tried to implement policies in terms of our IT softwares, in terms of our protocols, as well as in terms of how our staff and operations teams actually operate from a very early time frame. Now, as this evolves, as the kind of data that you start to capture gets more and more robust, and as it increases in size, there are their own challenges with respect to data storage, with respect to data access. One of the things that we've tried to do is we've actually created online platforms where patients can access their own reports and their own longitudinal history. So if you go to our website, medanta.org, you will find that there's an access for something what we call e-clinic, where you can not only do teleconsults, video consults, but you can actually access your medical records and your history throughout. And even in the case where we have paper copies of, say, your outpatient prescription, we scan that prescription, upload that prescription, so that not only is it visible to you as a patient, it is also visible to other doctors who would come into contact with you during the journey of care, and so that they could have access to you and understand what's going on. And we've actually done some innovative things around giving you trending information around how your blood report values are moving, etc. So when you take the case of, say, diabetes or chronic care management, if you can actually track certain blood parameters over time, you will be able to tell not only the doctor, but also the patient will be able to self-realize how their health is moving and how they're actually able to manage and monitor his health. And we are trying to increase this with using other technologies, things like wearables, etc. Really with the idea of empowering patients to take charge of their own health and take charge of their own data. Now, with increasing challenges in terms of cybersecurity, data hacks, all the kind of things that are happening in the world, we are beefing up our investment in this in a very big way, whether it is our data centers, whether it is our cybersecurity protocols, etc. And we have tried for the most part to ensure that whenever we partner with vendors, we try to ensure that all the data that we have with respect to patients is actually stored on our site. So while it may be a little bit more cumbersome in terms of using our own storage services rather than, say, cloud services, we try to actually ensure that we are able to be custodians of the data in a proper way with respect to the data that patients are sharing with us, and try to do the best we can given the constraints that exist in India. But also important to point out that still in India and frankly even around the world, a large part of the data is still not digitized, and even if it is digitized, it's not digitized in a way that can actually be analyzed and processed and help patients and help doctors improve the quality of the care by actually analyzing that data, not only for the individual patient but for population groups as well. So I think that will be our next journey, to actually see how do you take this data and make it a little bit more analyzable, use some of the upcoming technologies, whether it's artificial intelligence or data analytics, to actually improve that. So I think we've still got a long way to go, still very early in data management field in India, as well as for us in Medanta. But we're trying to keep as ahead of the curve as we can, given the constraints. Of course, you understand that a lot of these technologies tend to be very expensive. Many of them are still coming from outside of India. So as we get more and more organized around this, and as we find Indian companies, Indian entrepreneurs spending a lot more time on this, I think that you'll see a lot more growth in this field, a lot more awareness of this in the years to come.
Thank you for that, Pankaj. I think I have two following up questions in reference to your answer. The first one is, as a CEO, do you see a bottleneck in the mix of incumbent IT experts that you have internally in your system and the IT companies you work outside? Because we have received this feedback again and again from incumbent IT experts of large hospitals that either international exported IT solutions are not effectively addressing Indian patient population's demand, or they are simply threatened for the fact that maybe the IT company coming from outside will take their job, and large hospitals will actively outsource the entire IT department to an international health IT vendor. So, being the CEO of a very large hospital in India, how do you address that bottleneck? How do you make sure that there is a balance that is properly maintained between your incumbent IT personnel and the HIT companies you're working with?
Right. So I think, probably if you interview any hospital executive or any doctor from any hospital around the world, they will express a frustration with their electronic medical records or their IT systems in some shape or form. And I often joke with our IT head that, the people who are most likely to get cursed are some of the IT people, because everybody tends to get frustrated with IT at some point or the other. So
Yes.
I think that it's almost like part of the job when you're an IT professional, unfortunately. But look, we have phenomenal IT talent in our country. We are very lucky in Medanta to have an excellent IT team. We have extremely forward-looking, proactive group of people who are focused on thinking about digital healthcare, thinking about how we can use technology to improve patient care, and also very cognizant of the fact that IT should not be a burden on clinicians and care providers, but should actually be a tool to assist them to deliver better care, right? So you're not trying to replace a doctor with a machine. You're actually trying to see how does the doctor become more effective in the delivery of care, and how do you do this? Now, there are a couple of challenges with the big systems, like you pointed out. Obviously, many times homegrown systems or things that you kind of evolve are not able to deal, especially in our case, with the kind of patient load and the volumes we have. So not only is it stuff that we as healthcare consumers or patients would see on the front end, there's also this entire thing about how the database is moving in the back end, how slow things are, how you capture and churn all of this data. So what we found is that, the more established systems, which we have partnered with, tend to be a little bit more robust for managing scale. And the problem with these systems is many of them were designed outside of India, and many of them, frankly, were designed originally as billing systems and not as health
Yes.
record systems. And
Yes.
so what the focus of those systems tends to be is more around the financial aspects than around the medical and the scientific aspects. And the second part is that because a lot of them have been designed in the West, where it is predominantly an insurance or an organized payer market, so they are focused more on those types of activities where you're actually capturing every last activity, which can often get frustrating for clinicians, than on the things which are helping patients or doctors access the medical record. So I think that you've got a challenge with balancing the needs for having a robust system that has data security, that can manage loads and volumes, that will not give up, on you in the middle of a critical procedure, and being things which are more oriented towards the patients, easier to use, things like mobile applications and other apps, which patients are now demanding because of that's the way the world is moving. And so what we found is that, look, there is no one solution that will work for this. And we believe actually in creating a partnership and a network approach to delivering our IT needs. And so if you look at our health information system, which has components of the medical records as well as components of the financial aspects, that sits as our base layer. But on top of that, we have added mobile applications, things like our e-clinic applications. We have added what we call the mobile electronic record system, where our doctors can, even from home, access reports for patients, get critical alerts, etc. And also have a basic ecosystem of partners that we work with to develop and build on these solutions that can help both clinicians and caregivers as well as patients do a better job of managing this. So I don't think that there's any one solution that is going to solve this problem, but I think it's critical that we think about this from a partnership point of view. And to your point around, the incumbent versus the new, we were lucky when we started the institution not to have dealt with the legacy of, many years past. Now we've been around for 10 years. I'm sure today hospitals that are starting out think that what the kind of solutions we had when we started our legacy and our constraint. But we've been lucky in actually dealing with some of the partners, and they've been fairly proactive and flexible. And our IT team has been brilliant. So it's been a combination of internal build solutions, newer companies like some of the new startups which were coming out of India, as well as the incumbents, to actually look at how we integrate all of this and deliver the right solution for patients as well as for doctors.
Glad to know that. And Absolutely, I completely agree with you, and glad to know that you have been able to manage that balance very effectively between your incumbent IT experts and the international healthcare IT companies you're working with. I think speaking about the future of digital health in India, I think definitely large international healthcare IT companies have consolidated the market so far by working with large hospital systems and insurance providers very early on. They actually took the train pretty early, as you mentioned very correctly. But then we also have a very thriving digital health startup ecosystem in India that is looking for funding, looking for exposure opportunities to pilot their programs and solutions in large hospitals. They're working with some of the smaller and tier two, tier three hospitals, but then I think they have not been able to really penetrate the large hospitals in that context the way they ideally wanted to. So, from your perspective, do you think that the digital health startup ecosystem still needs to go a long way before they can be compared with the mature, more seasoned healthcare IT companies from the international market, or you think the time is there? In 2020 has basically created that much needed shift in healthcare CEOs' mindset and exploring options to work with them as well.
Yes, so I think the time is absolutely now. In fact, I think our healthcare, our digital startup ecosystem, our entrepreneurial culture has been thriving for some time and really itching to get access to the limelight. And in some ways, the COVID pandemic has allowed them that opportunity. What I also feel is that there are more traditional systems that have been a little bit averse to partnering with some of the digital and some of the up and coming organizations. And that fundamental disconnect actually has started to get broken, partially because of need through COVID and because of integration, but also because some of these institutions have now come together. So there is a very good partnership which is actually working on NDHM with the NHA called Swasth, which is a non-profit alliance of healthcare providers, insurance companies, startups, health IT companies that are actually working together. Started with COVID, but now expanding into helping how do we deliver healthcare to India for the whole population. So I think a lot has changed. I think there's still a lot more to be done, and I would love to see greater integration with some of the startups. I often tell some of the startups that when they come and interact with us is that five kids from IIT with a doctor on the advisory board doesn't necessarily make a good health tech company. Why don't
Right.
you come and spend some time in our hospital, work here,
Yes.
live here, interact with clinicians, partner with our ecosystem? Because there's a lot of things that are happening. And what I fear is that normally solutions which are designed in isolation of doctors and caregivers tend to be solutions that don't work, or solutions that doctors don't want. At the same
Yeah.
time, solutions that are designed by people who are delivering healthcare without understanding what are the needs of the patient are also systems that don't work. So the crux of this is actually understanding what is the problem we're actually addressing. Is it a problem for the patient? Is it a problem for the clinician? How do we actually integrate these things? A phenomenal solution, which is great for patients, which doctors don't use, is of no use. Likewise,
Correct.
if we make
Correct.
something that doctors are really excited about and patients find it too complicated to use, or simple stuff like it's in a language I don't understand, then it's
Correct.
not going to get wide acceptance. So I
Yeah.
think that the crux of this is how do you create these points where these systems can actually interact, can actually engage with each other in a much more meaningful way, not simply at a peripheral level where you're giving advice, but really at a symbiotic level, grow together is going to be key. And I think for that, you will see various types of partnerships evolve, whether it will be investments by hospital systems or bigger companies into startups, whether it will be things like incubation, whether it will be startups actually coming out of in bigger institutions. All these things will be key. But also key will be to understand that, look, India is a very diverse country, and the kind of healthcare that you may deliver in, say, a Delhi or a Bombay, or may not be the healthcare that you need to deliver in other rural parts of India. So we need to be cognizant of who is the patient that we are serving and what is the kind of need that we are addressing. So managing a heart attack and managing, patients who have TB or diarrhea is very, very
Yes.
different. And,
Correct.
frankly, technology is not going to solve all of these problems. So unless we
Right.
understand the key online offline interplay and what this means, and actually stitch that journey together for a patient, we will not be actually able to really solve the problem. And look, what most patients are looking for is, please cure me of my disease. Please actually address my underlying health condition. They are not necessarily looking for teleconsult as a solution, right? That is just
Yeah.
one
Yeah.
means to the end, which is to say, I need to get my health problem attended to. I'm not necessarily looking for a telemedicine solution. So we shouldn't
Right.
be making solutions for one aspect of the healthcare journey. We should be looking at this holistically and saying, what is it that patients need? How do I get doctors, nurses, other healthcare providers to deliver that need? And look at this more holistically. And that will require still a great amount of work. But I'm very, very excited about the developments and the opportunities that are coming out of Startup India.
Yeah, I'm proud to know that. And I think, yes, I agree with you. The time is right. I think 2021 will be a transformational year for startups as well. They're getting the much needed corporate buy-in from large hospitals to start their programs. And I think the key is to prioritize the solution, as you mentioned. Um, I think some of the startups don't always realize that healthcare is much bigger than just the clinical aspect of healthcare. There is an operational side, there is a financial side of healthcare, and healthcare business is not only dependent on saving patients' life, but then it also depends on creating a sustainable business for the community. And startups that are still in healthcare but catering to the financial and operational side of healthcare are actually relatively doing better than the clinical IT solutions when they directly compete with international IT companies. So I always advise my clients that, okay, apart from the clinical aspect of healthcare, what are the different other aspects that you can focus on and build solutions around? Because that's where you're likely to gain more traction versus the clinical side today in 2020 or 2021. So I think we are running out of time. We have so much more to cover as we initially discussed that probably half an hour will not be enough. And I would like to take this opportunity to request for probably another session in next year. We'll reach you in advance, and once you're
So
available, I would love to host you again. I do have some of the questions around your journey with Medanta, how you grew yourself as a businessman in the Indian healthcare context, which probably is one of the most complicated industries in India, with a lot of policies being involved and patients taking laws in their hand, and doctors are overwhelmed with burden of patient care. They literally have no time for their family, so there are a lot of complications to be surrounded with when you are the CEO of a large hospital. So how you manage to stay calm and look the way you do today is something that I'm really looking forward to know. And I think in the next session, we'll definitely deliberate on that and talk about other aspects that will be relevant in 2021. So with that being said, I would like to take your leave. And Pankaj, thank you so much for
thank you.
joining again, and hope to stay in touch and stay connected.
Thank you. Thank you very much.
Thank you so much. Thank you. Thank you, Kushbu.